April is Donate Life Month, and it's the perfect time to spread awareness on the process to become a living donor. Monica Rebielak, transplant surgeon at Unity Point Health Iowa Methodist Transplant Center, is here now with more information. And we've talked about organ transplants and organ donation, especially for deceased donors, but we don't always think about living organ donors, and there's a big need for that, especially for kidneys.
Yes, absolutely. There is a need, and in general, there are far more people that need transplants than there are organs available from deceased donors. So not many people know that they are eligible to be living donors. And again, it's a life-saving surgery. It's a procedure where someone comes in, they show interest, and they're willing to donate a healthy kidney of theirs. We're able to do it with a minimally invasive approach. We do them robotic-assisted laparoscopic surgery. I make some small incisions, one a little bit bigger, to extract the kidney, and we're then able to implant it into the recipient.
And what is the process? Because you were telling me it's a very thorough process.
Exactly. We have, a profound responsibility for the donor because we, go through a really intense screening process to really identify any risk factors to make it safe for the patient, not just now, but also the risk later on. The screening process involves blood work, imaging, psychosocial evaluation, and they also have an advocate that stays with the donor throughout the whole process up until the day of surgery.
Do a lot of people become living donors?
Yeah, and that's a great question. So in general, we turn away about 2 or 3 patients that come in to be screened. And again, it's because of that rigorous process that we want to make sure that it's safe for them. So we encourage anybody that wants to come and get evaluated and go through the process, and then we go from there.
It might be surprising to even hear people do this. Do they do this out of the goodness of their heart? Do they know someone who might need a kidney transplant?
Right. So, really, a donor can be a spouse, relative, friend, neighbor, but there are what we call the humanitarians, altruistic donors who just from the goodness of their heart, whether they resonated with the story that they heard or they just wanted to give back, and they approached to us without anybody in mind. But again, we have a whole list of patients that would love to receive a kidney, and we'll take care of that matching process for them.
How many people do need kidneys right now?
Yeah, so in general, for kidneys alone, from the year to now, it's about over 92,000 patients are waiting for an organ. And just last year in the United States, about 28,000 transplants were performed. Of those, a little over 6,000 were living donors. So like I said, there's just so many benefits to living donation, so we really want to encourage people to come forward.
And I remember when I first heard about this, I didn't even think, because we have 2 kidneys and we only need 1?
Exactly. You can live a very long, healthy life with 1 kidney. There are also patients who don't know they have 1 kidney and they're fully functioning. So like I said, we go through that process to make sure that there's no risk factors that donor themselves would develop kidney disease. But otherwise, donors feel very fulfilled. Really, their stories are so inspiring. And the beauty is that they become advocates themselves. And my goal, with our whole program is to make the experience just as rewarding for the donor as it is the recipient.
And it's really a selfless act. I would imagine, are you inspired when you meet the donor?
Absolutely. In our eyes, they're heroes. They really, really are. And it's one of the most selfless acts that you can do. And that's one of the reasons I love doing it. I want to be a part of that, to be able to transfer a gift from one person to the other.
And so people just reach out and express interest, and you'll get the ball rolling.
That's exactly right. And again, we have a phenomenal staff with coordinators that can answer any questions that you have, how the process starts. And the good things is we can time it, anything according to a busy schedule that I know everybody has. We do everything we can to accommodate that.
Because how long does it take to recover from the surgery?
Yeah, and that's a great question. So the surgery itself is only a few hours. Afterwards, patients leave the hospital in about a day or 2. They finish recovering at home. Usually about 2 weeks they feel themselves and they're ready to go back to work, about 4 to 6 weeks.
Wow, that's amazing.
Yeah.
Well, quick recovery for true heroes.
Absolutely.
Thank you for being here to share this with us, living organ donation for kidneys. We appreciate it.
My pleasure. Thank you for having me.
And you can learn more. Just go to unitypoint.org. You can also find them on social media.